It happens in approximately 1 out of every 6,000 operations. A surgical team unintentionally leaves something such as a sponge inside of a patient. Doctors at Mayo Clinic want to make sure that doesn't happen. They're using grocery store barcode technology to account for all sponges in hopes of reducing errors in the operating room. 5 sponges accounted for and ready for use in this operation.
Those longer cases, yes, you might run through many packs of sponges, upwards of 200, 300.
And on rare occasions, one can get left behind.
And what we found was it's just a problem with human error in the sense of when you have a complex environment and you're trying to count something, that sometimes a simple math mistake happens and it resulted in a retained sponge.
So to combat this rare but real problem, Dr. Robert Sema equipped his OR with barcode technology. He wants to be sure that any sponge that goes in comes out.
It keeps a ledger of how many we've counted in and counted out.
The technology is similar to what they use at the grocery store checkout line, which is very accurate. There's only one mistake for every several million swipes of the barcode. Even so, Dr. Sema's team continues to manually count every sponge and record the numbers on a whiteboard. Barcode technology is part of the checks and balances used to reduce errors and improve safety for every patient who comes into this operating room.
And that's really the advantage to the technology, that it's reliable, it's safe, it's a simple technology.
Dr. Sema wants to remind you that leaving an object behind in a patient is a very rare occurrence. But if it does happen, the retained objects can cause problems such as pain and infections. He says barcode technology will help reduce these types of errors in the operating room. He's also looking at technologies to help track other surgical instruments used in the OR, such as needles and clamps. For Medical Edge, I'm Vivian Williams.